Welcome to SheTV.com, where board-certified physicians talk to you about women's health. In this video, Dr. Dana Bock, a board-certified anesthesiologist, explains why her anesthesia group is special in comparison to the average anesthesia group. She is interviewed by Dr. Arielle Allen, a board-certified urogynecologist.
Dr. Bock, I absolutely love working with your anesthesia group, and I feel so blessed and so lucky to be able to have you guys in your group take care of me and my patients. And so I would just want everyone to know how lucky we are at this hospital to have you guys take care of our patients. Can you tell me a little bit more about your group, your anesthesia group, and why it is so special and why I am so lucky?
Wow. Dr. Allen, thank you so much. I have been doing anesthesia for a very long time. I say that I came with the building. When the hospital was built 26 years ago, I practiced in a group at Baptist Medical Center, and our group covered the initial opening of Lakeside Women's Hospital. It was a Renaissance hospital at the time. It has gone through a couple of name changes and is now Lakeside Women's Hospital. It is a part of the Integris system. But I've been able to do anesthesia out there for almost the entire 26 years that it's been open. Our anesthesia group, currently we have been in our group, Oklahoma City Anesthesia, has been there since 1999. I left my previous group and joined that group in 2002, and we are all board certified physicians. We all take care of one patient at a time. We do anesthesia in the operating room. We do anesthesia in the endoscopy suite for IV sedations, for colonoscopies and esophagogastroduodenoscopies. And we do labor and delivery anesthesia. So that's usually labor epidurals, but also C-sections, spinals and things like that for C-sections. And I love it. Lakeside is a fabulous place to work. I worked at Baptist for about 9 years prior to that. And when I found Lakeside, it was exactly what I was looking for in a practice. It's a small town, kind of small home feeling. We all care about each other, from everybody that works there, the physicians, the surgeons, the anesthesia, all the nursing staff, all the scrub techs, all of that. Everybody cares about each other. And I think patients see that when they come in. But I've been with my group, Oklahoma City Anesthesia, now for many years. I am now one of the senior partners, and I kind of hate to say that, but it's true. As time goes on, we all get a little bit older, and we bring in these younger partners, and I'm like, I'm old enough to be your mother. But I've got fabulous partners, young, medium age, and then there are a couple of us that are still in that older group that have been around a long time. But we really enjoy practicing there at Lakeside. We will take care of you from start to finish. Each doctor is assigned to an operating room, and whatever patients are seen in that operating room, we do pre-op visits, take care of them intra-op, take care of them get them into the recovery room, take care of any problems that might happen on the floor. That's kind of a normal day for the operating room. And then if we're out on labor and delivery, we're usually doing a 24-hour shift out there, taking care of moms and babies out there.
That is so amazing. And I feel like our hospital is so lucky to have board certified anesthesiologists 24/7. It is in this day and age,
a rarity.
That's rare.
Yes, it is a rarity nowadays. When I first started practice in the 90s, it was more common, but nowadays there's a provider model where MDs supervise CRNAs, which are certified registered nurse anesthetists. They have nursing school and then 2 years of anesthesia training, whereas a board certified physician anesthesiologist has 4 years of undergrad, 4 years of medical school, and 4 years of anesthesia training. Not as much training as you have when you did your gynecology fellowship. I think we talked about that before, but we all have 12 years of training, counting, counting college, undergrad, and then medical school, and then anesthesia training. I really enjoy taking care of patients as opposed to being assigned to supervise nurse anesthetist or anesthesia associates. There is also a CAA, that's a certified anesthesia associate. I prefer to work on my own and take care of my own patients. But the model nowadays that's very common in Oklahoma City and really across the country is that a physician anesthesiologist would supervise 3 or 4 nurse anesthetists or CAAs. And so they're there to help with induction, and they're there kind of at wake up, but they're not necessarily in the room at all times. And we prefer to do it a one-on-one basis. We are really proud that we have that at our facility. We're a small hospital, but we are able to provide what we feel is the best care for all of our patients there, one-to-one individualized basis.
Man, and I love that. And I love to be able to tell my patients that fact. I love to be able to say, you're going to have an anesthesiologist the entire time throughout your entire surgery. And I'm sure it makes my patients feel more comfortable. So I very much appreciate you guys being there for that, for my patients.
Thank you very much for that, Dr. Allen. We certainly enjoy working with you and all of the other gynecologists and obstetricians that work at our facility. Again, as I've said earlier, it's just kind of a small hometown feeling.
Yes. And it's a great hospital. And you're right. It is like a family. We are like a family.
Yes. One other thing that I hadn't thought to mention is that in the anesthesia world, the anesthesiologists, they're only about 30% female nowadays, which when I first started in the 90s, it was more like 10 or 15% female. It was a more male-dominated specialty. As I have grown up in the practice and practiced over these 30 years, we are seeing that probably more like 35% female nationwide. But our group, since we are at a women's hospital and we take care of women on a day-to-day basis, we actually have 3 board-certified female anesthesiologists in our group, and we have 2 males that work full-time. So we actually are above and beyond the 50%.
And that's right.
and as a girl, I'm kind of proud to brag about that.
Absolutely. And it's just a perfect
That's a small
fit.
thing, but it is a perfect fit. It is.
It's a perfect fit for our hospital. Absolutely.
Thank you so much for
blessed.
asking me about that. And
yes,
it's been enjoyable to visit with you today.
Well, it's been great. Thank you so much.
You bet. All righty. Signing off for
you.
now. Bye-bye.
Bye.
Thank you for watching SheTV.com, where board-certified physicians talk to you about women's health. Please check back often, as we will be constantly adding new content. If you have any questions or particular subjects you would like us to address, please email us at shetv.com.